Frank. Thank you all so much for coming on to tonight's webinar through the Health Autonomy Clinic with the Sanctuary and the Nature Lab, which we'll talk about in a little bit. And we're going to be talking about addressing social inequities, social disparities in times of crisis. And you know, a lot has happened definitely since we planned the title and planned the webinar. And so hopefully we can at least come together as a community to understand a little bit about what's happening and how we can move forward together as a community. Social disparities in the crisis. And this is to counter the narrative that everyone is in this together that has been often talked about over the last couple months. And, you know, to highlight how this crisis is unmasking already existing social disparities. We're going to be looking at also how the crisis is being used to augment structural violence with the use of essential workers, and how this crisis is affecting communities of color, undocumented, economically marginalized, and indigenous communities. You know, I know personally it seems like a real struggle to keep up with the flood of information about the current COVID crisis. And, you know, this kind of way that those in power are forcing us back to a quote unquote normal. The over-reliance of the economy as a marker of anything lending towards what health or community could be. And then in the last week especially, but over the last few weeks, the horrific news from Georgia, Minneapolis, from Louisville, the murders of Ahmaud Arbery, George Floyd, Breonna Taylor in the past, just a horrific stark reminder of the crises behind the crises. That COVID has only exacerbated the social oppressions and disparities that mark this normal that so many of those in power would like us to return to. So what we hope to answer today, or at least begin to answer, is what is happening to Black, Latinx, Indigenous, poor communities in the midst of this crisis? How do we highlight their voices as we struggle for a new world, a new normal that includes marginalized populations at the center of that world? And to help us answer these questions are a few experts that we've been lucky enough to have gathered with us today. Dr. Linelle Campbell is Chief Resident in Emergency Medicine, or Rising Chief Resident in Emergency Medicine at Jacobi Montefiore Medical Center in the Bronx, New York. Dr. Campbell received her medical degree from Howard University's College of Medicine, holds a Master of Science in Educational Leadership from CUNY Brooklyn College, is a former chair for the Diversity and Inclusion Committee of the Emergency Medicine Resident Association, and the chair for the Resident Committee for the Academy of Diversity and Inclusion in Emergency Medicine of the Society of Academic Emergency Medicine. Wow, that's a lot of titles. She also currently serves as a union delegate at our hospital for the Committee of Interns and Residents, and her interests include mentoring and improvement of the recruitment practices of underrepresented minorities into the medical field, resident advocacy, security, and workplace violence. With her is Asi-Yahola Boutell, who is a lifelong advocate and aspiring champion of social justice, born in Oakland and raised in San Francisco, holds master's degrees in bioethics and biomedical sciences, and is currently pursuing degrees in public health and medicine. His interests include the intersections of sociology and medicine and community empowerment. He has a wealth of experience with grassroots organizing and education in Boston and New York, which he looks forward to applying as an emergency physician in the service of all communities under attack by structural violence and oppression. So we have Lisa Good with Urban Grief. Lisa Good, Master of Social Work, is the founder and director of Urban Grief, a trauma-informed community-based organization that educates on the effects of violence and supports those affected through outreach and victim advocacy. She's the former director of SNUG, known as Cure Violence, and has over 25 years of human service experience. She's an experienced speaker and trainer facilitating trauma-informed workshops such as adverse childhood experiences, community events, and faith-based workshops aimed at creating healing spaces and empowering community members through information about trauma, grief, and resilience. And finally, Luz Marquez-Benbow is a Just Beginnings Collaborative Fellow, where she focused on building a survivor network of Black, Latinx, Afro-descendants to advance social change and movement building toward ending child sexual abuse. For 15 years, Luz has worked on issues related to sexual assault and community organizing. So we have a super expert panel, and we're really excited. So we're going to just dive in. and get started. So to start talking about the public health disparities, we're gonna have Asi and Dr. Campbell talk about the social disparities that we're noticing within this time of COVID crisis. So take it away.
All right. First, I'd like to say thank you for the introduction and for holding this event. I'd like to open our talk about the public health implications of COVID and why it attacks Black and Brown communities the hardest by talking about language, the language that we use. So let me see if I can share my screen here for you guys. So you can see my slides. Okay, and share. All right, can you guys see that okay? Okay, so when we talk about disparity, I prefer to use the term inequity because inequity, when you think of health in terms of inequality or injustice, that there's accountability there. There's social, structural, and systemic accountability, forces that are causing these issues. If you use disparity, it just seems like a natural order of things. Like it's just, oh, it's just the way things are. But when you use language such as inequity or high-risk conditions, or talk about how these communities are made vulnerable by very specific policies that benefit certain groups over others, when you talk about oppression and repression versus marginalization, when we stray away from those euphemisms, we get people thinking about the underlying injustices that are fueling these health issues, the underlying economic policies and austerity. Like if you talk about public resources being scarce as if it was running just a drought like water, then you don't see the economic policies that were put into place in order to extract wealth from the working class and these forced austerity and unjust rationing that's a result of our capitalist system is what's giving rise to these negative health outcomes. And with that, I'll step off my soapbox and pass it to Dr. Campbell to talk to us about the pathophysiological mechanisms of COVID, how it attacks the body, and then I'll jump back in throughout the talk.
All right, that's excellent, Asi. Can everyone hear me okay? Let's see.
Yes.
Okay, you can. Okay, great. Thanks, Asi. And I just want to second what Asi said about vocabulary and using language. I mean, I think it's a really important point to make that the language that we use to discuss this is paramount to sort of the mission that we're on with this, especially in times like this where you have a lot of people who are very, emotions are running very high, and, for anyone in a position to sort of make a change or who has a platform, we need to make sure that we're using the right terms when we're talking about this. It's very helpful also when you have people who don't know about this, to give them the language, to empower them to understand things that they, previously didn't even have to think about. So I just want to thank Asi for even putting that out there, that the language is very important. So I'll just start very quickly. We talk about language. I'm going to talk all this medical language now, but try to break it down a little bit. So basically, COVID-19 is a virus. It's this group of viruses that have been, coronaviruses have been around forever. A lot of kids get different types of coronaviruses and they do fine. This specific COVID coronavirus that we have is a new virus, hence why we don't have a vaccine for it, and hence why we've been sort of on edge about it. So how it basically works is it attacks proteins in our bodies that trigger an immune response. The same way as when you get sick, you get a fever, that's an immune response. The same way when you get sick, you get a stuffy nose, you cough. Those are all immune responses in our bodies, which is normal and it's good. It shows that your body's working. But sometimes these immune responses take over. And your body can't compensate well enough for it. And unfortunately with COVID, that's one of the things that it does. It binds to a specific protein that we call the ACE2 protein. And that protein is found in your lungs, in your skin cells, in your bladder, in your heart, in your kidneys, in your small intestines, all these major organs. And what we've been finding is that this overwhelming attack on that protein from this virus is overwhelming a lot of people's bodies, and it leads to essentially organ failure. So this is why unfortunately, it's attacked a lot of people. You know, we've seen a lot of elderly people pass away from this because, unfortunately, as you get older, your immune system gets weaker. And so this is why it's sort of important to understand how it works. So just all this medical stuff aside, for the most part, we're going to delve back into sort of what does this really mean for our communities. And what we've seen is that a lot of, you know, Black and Latinx people have been disproportionately affected by this disease. You know, we talked initially when COVID first came out, we were talking mostly about, you know, the elderly patients, but then we started seeing some of our own patients. And for those of you, I'm in the Bronx, and we were hit very hard by this. And it was heartbreaking to see, obviously, elderly people getting sick, but even young people, you know, in their 20s, in their 30s, getting extremely sick and unfortunately passing away. And so when we look at some of these mortality rates, you know, I'm not going to read, you know, I'm sure you guys can read the slides, but it was just disproportionate. And the problem with that was that a lot of places, CDC was not requiring places to really document this data. There were only a select few cities around the country that were doing that. But once it came out and there was a lot of pressure put on more cities to do it, we started seeing these disparities come out, all these racial, you know, issues. And, you know, I talk about the zip code issues. You know, when you look at all the zip codes around the country, you know, obviously I was looking more in the Bronx, but we noticed that in the zip codes where we had the poorest people, you know, where we already had healthcare disparities, where we already had all these socioeconomic disparities, that we were noticing these are where all the people were getting sick. You know, people were getting sick in Manhattan, of course, but not as sick as they were in the Bronx and in certain parts of Brooklyn. And so even when looking around the country here, you know, New York City, we just talked about that. In Chicago, it was the same thing. You know, you're seeing 60, you know, these huge disparities, not just, you know, 1 or 2%. These are almost 20% disparities, you know, almost, you know, triple the rate that you're seeing. I mean, there were places where they had, I think it was in St. Louis, where 70% of their cases, you know, whereas, so in some places, let's say the African-American community made up 20% of that population, they were seeing them as 70% of not just getting sick, but dying from COVID. So these are really, 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 really eye-opening statistics that, again, they weren't recording it. And so people didn't know, but guess what? Now they're recording it and now we know. And so it opens up this whole other conversation that needs to be had even in the House of Medicine. And so the big question is why? You know, like why is this happening? No, it's not a conspiracy. No, it's not 5G. No, it's not any of these things that people were putting out there. I'll say this, and no, it wasn't just COVID-19. You know, these are issues that were around before, you know, 2020, you know, and there's a great list here that, and it's not just one issue, it's multiple things that have been going on, not just for decades, for centuries in this country. And it's a big, big, complex situation of social and structural determinants of health, racism and discrimination, economic and educational disadvantages, healthcare access and quality, individual behaviors, and biology. But I'm going to stress A through D even more, because A through D are the things that scare me the most, because the people who are getting affected the most by this don't have the power to sometimes dismantle a lot of those things, or have the power to change a lot of situations that are going on in those in what we have listed there as A through D. And so it's more of, you know, it's more than just, oh, go to your doctor, you know, oh, make sure you eat, you know, fruits and vegetables. No, it has to deal with the fact that a lot of these people in these areas, you know, it's been like this for hundreds of years, you know, and it's not just in 2020. It's a hard thing to sometimes pinpoint, and that's the scary part. But you know, I think Asi is going to talk a little bit more about how we can really change this and how we can make it better despite everything that's happened. And I was saying before, and I've been saying to everyone, COVID has been horrible, and it's been a really negative thing for a lot of people. Me personally, a lot of my colleagues, a lot of family that I know, a lot of my friends. But the positive part about this is now it's out there. No one can hide anymore to say, well, I didn't know this was going on. It's out there now. And we have to sort of channel a lot of these, a lot of the anger that people have, a lot of the ignorance that people have, and channel our platforms to sort of make these changes where we can and how we can. I'm just going to pass it off to Asi. So.
Okay. So context is key. And what I mean by that is, we have all these numbers about, morbidity and mortality and how many people are dying from COVID and what color they are. But without the proper context, that information can be harmful. It can lead to fueling stereotypes. It can lead to people trying to misattribute or overemphasize biological determinants rather than social determinants of disease. And it can lead to people trying to blame behavioral patterns, say, well, Black people are getting higher rates of COVID because, I don't know, they're lazy, they smoke, or different things like that, instead of looking at things about their environment. Like, for instance, they live near a highway, or they live in a project tenement with 3 generations of their family and 10 stories of people just packed together in overcrowded, poor housing. Of course, they're going to see higher rates of COVID and disease. And so we need to combine this morbidity and mortality data with social data, economic data, and look at what policies have shaped the lives of these people that have given rise to these poor health outcomes. And I'm changing the slide on my iPad. There we go. So what that means is taking a social justice lens to the data. And I have these little pictures of these little birdies here because these are Darwin's finches, and studying them is what led him to a lot of his insights and ideas about natural selection and evolution. Their environment shaped, their beaks and their bodies and their physiology and their anatomy. And in much the same way, their environment was the determining factor and so much for them. Our environment as people is the world, the cities we live in, the policies that shape our lives, the economics and political structure of our world. It's a man-made environment, but it's every bit as important as the environment that these finches live in. So, for instance, our environment isn't trees and forests, but it's housing where we have been redlined and discriminated against and corralled into poor communities near highways and things. There's something called location-based risk that is fueling a lot of disparities with COVID, where people have higher rates of pollution that can lead to asthma or things like that can increase your vulnerability to COVID. Or they live in food deserts in places where they can't get good nutrition, and so they have higher rates of diabetes, which is vascular disease, which makes them more vulnerable to the COVID virus and those more severe complications of it. Or economically, they're forced into lower wage jobs. They cook our meals, they serve our food, they deliver us from A to B, deliver our food. They're in public facing jobs that have now been deemed essential, but they're coerced to be there. And a lot of times their wages or their insurance is tied to their employment. So if they lose their job, not only do they miss out on wages, but they miss out on their health insurance coverage. So when you make policies, blanket policies like shelter in place or something, we have to be mindful that that's a privilege that a lot of people don't have. Okay, next slide. So we have to combine the data to make these connections and to illuminate these connections. And there's one great example of this. One of my mother's mentors, Dr. Nancy Krieger at Harvard School of Public Health. They have Harvard Public Health Disparities geocoding projects, and that's using publicly available census data on socioeconomic status and things like that, and combining it with health data for COVID in order to try to spotlight these upstream causes of the disparate impacts that we're seeing in minority communities. And some of these connections and things that they're studying and looking at are resource deprivation. So for instance, communities that have only limited hospitals or public hospitals that are underfunded and only have like 2 ventilators, things like that. Chronic stress and the impact of that. We're still very actively studying how stress impacts the body, and the chronic stress of enduring racism in this country is responsible, like it constantly activates our fight or flight response at like this lower level that we're seeing. And there's ongoing studies about how this impacts our bodies, our hypothalamic pituitary axis, and the regulation of hormones. And this governs our genetics. This governs how we respond to disease, and poor housing conditions and barriers to healthcare, such as poor insurance and or xenophobia and minority Latinx communities being afraid to go to the doctor because they might be deported. All these things, these forces interact to produce these negative outcomes for minority communities. It's very important that the messaging and the public health messaging that we relay to people is culturally competent and community competent. What that means is that on the ground, the lived realities of people are taken into account with public health measures, such as like what I alluded to with the social distancing. Like if you're imposing social distancing and shelter-in-place orders on communities that and without providing for their livelihoods, it can do more harm than good, which is what we're seeing, and with the epidemic continuing to explode. So those messages have to be adapted to those realities of those communities. Public health policy can be a double-edged sword in that respect, where things that are intended to be good can cause harm, like if they're enforced unequitably, or if they don't have if they're not mindful of those lived realities of people on the ground. So for instance, that's why we're seeing in New York City, 80% of the people arrested for the shelter at home violations were Black and brown. Or for instance, shelter in place orders, homeless people being arrested for not being able to shelter in place. It's just mind boggling that we're attacking people without giving them the means to comply to these very sound public health strategies. Testing is another big thing. Like we know that testing works and that it's the best weapon we have right now, but we're limiting testing to only a subset of the population. We're making it very hard to do and access, and it's making it symptom based, even though we know that this virus can be asymptomatic for up to 2 weeks, where you're actively shedding virus and spreading it to the community. So we need just to revamp our public health strategy and make sure that it's culturally and community competent. And my final slide here, just on one side we have, this was put together by the Association of the Black Cardiologists, and it was a very recent paper that they published. So on the one side we have COVID-19 health disparities and the social determinants of those disparities, the socioeconomic factors, access to healthcare, the disproportionate burden of comorbidities, diabetes, heart disease, and all those things that are unequitably distributed amongst communities of color, discrimination, unemployment that we talked about, and biological mechanisms and cultural, those are secondary to all these other reasons. So what can we do about it? We need multifaceted approaches and solutions that look at the upstream factors, such as housing, nutrition, and good food, and healthcare coverage. It's a for-profit healthcare system is incompatible with the needs of a pandemic, and we're seeing that right now. With we have well over 100,000 and counting of cases, and I think we represent over almost 40% of the cases in the entire world because of it. And we have to support education, but make sure that it's culturally and community competent, like I mentioned, and improve computer and internet access to try to bridge the digital divide. Because if we have people sheltering in place and working from home and migrating health to telehealth, that's leaving out a whole swath of the population that doesn't have access to basic internet. Or like, how are we going to tell people in Flint, Michigan, living in a poor community who don't have internet or water, if we're just trying to send a message to them to wash their hands all day, and then the water they have is polluted. And then poor worker protections. We don't have paid sick leave for people, childcare, things like that. It's just a perfect storm of inequity and poor social policy that's fueling the pandemic, and we have to start upstream at those areas if we're going to have any hope of ending it.
Right. I just wanted to add in, and I should have mentioned it as well, and I think we talked a little bit about this, was also this concept of like essential workers. One of the things, I actually wrote a paper on this a couple of weeks back, and it was looking at the demographics of essential workers. A lot of these essential workers tend to be people of color, Black and Latinx people, who are working in a lot of these jobs, and not so much, the doctors and the nurses, but we're talking about grocery store workers, delivery drivers, and things like that. And a lot of these jobs, these workers don't have benefits. And so, Asi just mentioned things like, paid family leave and, housing and things like that. They can't afford to not work, And so I think that's another disparity or inequity that we need to really start taking a look at, is how are we protecting these essential workers who are working in these fields that don't offer them benefits. Like I'll just give, the Amazon workers that walked out, some of them lost their jobs, and that's their entire livelihood. So that's another inequity that we need to always remember, that, when we're calling people essential workers, we're seeing all these commercials and everything like that. It's not all, it's not all glitter and gold for them. So these are things we really need to keep in the forefront of our minds when we look at this.
All right, Frank, that's all I got.
Wow, that was amazing. Thank you so much. And perfectly on time. I know people have questions about everything. I was wondering, are those slides something that you could, can we send out to people, or is it something you could upload into the chat?
Absolutely.
Either way, yeah. That would be really great and really helpful. Well, thank you to both of you. And I know, Dr. Campbell, you have to get out at like 7:30, so thank you so much. Well, moving from kind of a public health lens, we're going to talk about, again, these structural issues of structural violence and how it's kind of shaping the context in which we find this pandemic, as well as looking at community healing and looking at grief, which I know personally is a term that I have always strayed away from, and only recently have come to this realization of the importance of embracing grief as part of a healing. So Lisa Good will help explain her work with urban grief, but also her work in the community and her understanding of the context of the COVID.
Hello, how are you? It's so good to be with you guys tonight. So that was an awesome presentation. I think when I think about what's happening with COVID-19 and grief and in the context of community and healing, one of the things that, and then especially in light of all of the protests and the current conditions that we are dealing with, one of the things that I think about is that before the pandemic came, things were already very bad. In terms of access to healthcare, resources, how patients are treated, the experiences that they're having within our medical institutions. So things were already, very difficult, in my opinion. And when you look at these intersecting aspects of, location and poverty and community violence and all of these different things that really hit our communities really, really hard. Pre-pandemic, like I said, things were already challenging. And then we enter into this pandemic and all of the layers are just ripped off, right? All of the inequities are completely exposed for the whole world to see. And so when I frame that in the context of historical trauma, in terms of Black and Brown people and their experience with medical care, medical institutions, all of those kinds of things, and I loop it back to pre-pandemic, and I say all things were already difficult, and we enter into this pandemic. and we see the numbers, and even when now the numbers are public and we know what they are, we know what the risks are, we have some information about, practices around social distancing and wearing a mask and that kind of thing, that there are some people who may choose still not to do that because they're not sure if it's true. They don't know what to believe. And so part of, to me, what I see happening, at least on social media and even the media, and it goes back to those terms that you were talking about and the language that you were talking about early, is the first thing that hits me is the language of blame. And without understanding or acknowledging this context of historical trauma, specifically related to Black and Brown people's interactions and experiences within the medical system or the medical care system. And so then we enter into this pandemic and we see all of the, the deaths and the losses and the sicknesses and that kind of thing. But at the same time, at the very basic community level, nothing has changed in terms of the violence, right? In fact, it's increased. So when we talk about domestic violence, that's been publicly presented. There's increase in domestic violence, but what's been less talked about and discussed is the increase in gun violence, the increase in community violence, or the increase in child abuse, and the increase in child sexual abuse. And so as we look at, all of the state-sanctioned violence, with these murders and just all of the unrest and the protest, we're in a real complex place right now, where when you mention that stress level, people are very triggered, right? So if my baseline pre-pandemic was here in terms of my stress, that's my baseline, because life is rough, right? It's challenging. But this is my baseline. And then we get into pandemic and now it's here. And then we have everything that's going on now, and now it's here. Where else is there to go? And so when I think about the impact on health and the emotional well-being of folks in our communities, it's first of all, it was already cumulative. It was cumulative based on our collective experiences as Black and Brown people in this community. It was cumulative, right? The trauma of racism and discrimination, these experiences were cumulative from slavery to the Reconstruction era, through the Jim Crow era, through the Civil Rights era, okay? And right up until the present moment. So we have this cumulative and collective experience as a group of people that we are already, our health has already been impacted from the long-term exposure to the trauma of just being Black and Brown and having been brought to this country in chattel slavery, right? So it's cumulative. And so when you combine that experience, that collective trauma, and you put it in the context of all of the structural violence that has really marginalized and disenfranchised entire segments of the population, while yet punishing them for not being what, we say an American or a person who represents the so-called values of this country should look like and should produce. And so, when I think about, this in the context of grief and loss, I'm very aware, just even in my own body, that it didn't take a lot. right? Like, pandemic, wait, COVID-19, wait, okay, sickness, okay, we're going to be sheltering in place. Okay, when, all of these things, it didn't take a lot, but the cases that are in the media around the racial violence, you got to keep in mind, these are the cases that are the flashpoints right now. But for those of us who are, staying abreast, because violence is my thing, right? I got to know what's impacting the people I serve. So we're bombarded with this. So these are the flashpoints, but there have been many Black men, Black women, trans people. There are many people that have been killed, by state-sanctioned violence, by police, because of racism, because of bias. And so when it looks like we are overreacting, actually, we're finally reacting. And so the pain, it's just cumulative. And so when I think about our grief, when I think about this in the context of grief, so grief is typically defined as, in the most basic way, it's the affective or emotional response to loss, right? And those losses are not just related to death. Death is not the only loss that can create grief or lead to grief, whereas mourning is the outward expression of that grief, right? And so typically in Black and Brown communities, our grief and our expressions of mourning have been disenfranchised, right? That there is no space for us to grieve. There is no time and opportunity to grieve, because even in the context of COVID, to your point earlier, many of our folks are the essential workers. I was talking to someone earlier about the welfare to work legislation that was signed back in the late 1990s when Clinton was president, right? And how there was this real push, using the stereotype of the welfare queen as a Black woman, when the numbers did not support that stereotype, by the way, in terms of who was actually, receiving benefits. But that was the stereotype that was put forth. And it led to a lot of training programs and all of these other kinds of things that were initiated in the communities. And a big part of that resulted in, it created opportunities for a lot of Black and Brown women and men to become nursing assistants or CNAs or personal care assistants and that kind of thing. And so when you fast forward it and you see, even in the medical profession, who's on the front line, they have the risk, but not the status or the protections or the luxuries that go with some of that. So when I think about the losses, around COVID-19, around community violence, around state-sanctioned violence, I think of the loss of safety, the loss of the right to grieve, the loss of dignity that, even in COVID, like there's no dignity in your death, the loss of ritual, okay? The loss of community, the loss of the ability to actually come together and share in the ways that traditionally bring us comfort. And so all of that creates this additional layer of trauma in conjunction with a fear of medical institutions, right? That links back to that historical trauma. So in my opinion, some of the people who are sick and who probably have COVID symptoms, they wait longer before they go because of past experiences of not being believed by medical professionals, not being given the same, treatment, being poorly treated, and not really having an advocate or a voice to where they can, you know, express that and have it validated, versus being treated with hostility or disdain because you are expressing a concern, or you are requesting a medical test, or you are questioning, and that is a loss. And that magnifies the experiences that patients are having or people in our community are having with COVID. And when you layer that experience in conjunction with isolation, there are very limited opportunities for collective grieving. So when you see the protest and you see a group of people that are willing to come forward in spite of COVID, really what I see is, you know, we are grieving, and we are going to come together and collectively grieve in the form of protest, and nothing is going to stop us. And so when you talk about healing, I think that we have to make space for the conversation around disenfranchised grief and how we've shut certain people out from the opportunity to grieve, how we rob them of that, how we have suffocated people's grief, the grief of Black and Brown people, by penalizing them for the normal expressions of grief. I call it the criminalization of grief, where, you know, there's expressions of mourning and people are penalized or punished in some kind of way. And so when we think about how we move forward, healing is a must, and it is a legitimate part of the healthcare response, because if we are able to create collective healing, then that lowers the stress response, because now we're in community where our voice is heard and we are able to connect and support one another.
Oh, thank you so much.
Amazing.
It's going to take a little moment to let that settle in. That was, that was really powerful.
As we say in the gender-based violence world, breathe. Breath is life. As my people say in Puerto Rico after Maria, drink water. Water is life. And as our Native Americans remind us every day, the earth, touch it, because it is life. And so I thank you all. I'm honored to be in this space. Can I go, Frank?
You're on.
Yeah, I'm honored to be in this space. I'm deeply honored. I need you all to know that my name is Luz Marquez, and they announced me and what I do in terms of gender-based violence. That's sort of, I don't call it my professional work, that's my life work. I'm a survivor of childhood sexual abuse, and that's what I've done. But I'm also a resident of Troy, New York, which is in the capital region of New York State. It is 3 hours north of New York City and about 4 or 5 hours east of Buffalo. We are a small city, but a very beautiful city. And we have a group in Troy that evolved in 2017 as a result of violence that we experience as Black people. And we were started off with language. Language is very critical. Language is very critical. I happen to speak two languages, and I speak Spanish, and it's very, very critical in order to be able to communicate, because communication is important. And so before I go on to talk about justice for Dahmeek and the cases and how police brutality is weaved into this discussion about a public health crisis and COVID, right? Like the juxtaposition of COVID and police violence and the impact that has as a public health issue in the lives of Black people. And I'm sorry, I'm going to say to all of my colleagues that from here on, I am going to preface this as we're going to talk about Black people from here on. So I know you started this by talking about Black, indigenous, people of color. I know we're talking about Latinos, I just said Puerto Riqueña, but we're talking about Black people, because we've been told a whole bunch of lies. Our people have been told a whole bunch of lies, and we have been taught that Latinos is a race, and it's not a race, it is an ethnicity. And so from here on, we're gonna talk about Black people, because Black people have been attacked, and we have a long history. But before I go there, I wanna tell you that I am mentored by Ntozake Shange, Kambahi River Collective, and Assata Shakur and many that came before me. And so while I, unlike my colleagues, don't have a degree, I have what I call a PhD and a homegirl from around the way. Do you understand who you're talking to? And I need you to know that. You're also talking to someone who's a public policy person and has reauthorized the Violence Against Women Act twice in my lifetime. And I got to sign it behind the first Black president that we've had in the United States, Obama, in 2010, to ensure what Asi-Yahola and Linelle talk about when they talk about equity. Because the violence against women work is not equitable in this country. And so in other words, the only folks that get funding and get support are white mainstream rape crisis programs, white mainstream domestic violence victims, and they've allowed Black women, Black children, Black men, Black trans people, Black people with disabilities, Black immigrants, Black homeless people, Black sex workers, Black traffic workers on their own and made us all disposable. So that same equity that we have as a public health issue, right, in terms of COVID, in terms of the things that my colleagues have laid out to you, also extends into the gender-based violence against women movement. And I need you all to know. And I, this little girl from Harlem, made it so that when I was 12, no one in Harlem talked to me and my family about what it meant, what was sexual violence, what was child sexual abuse. But I lived about 6 blocks from Mount Sinai Hospital, one of the best top hospitals in New York City. I was between Mount Sinai and Metropolitan. Metropolitan is poor, it's low key, it's a community hospital, it lacks all types of shit. Mount Sinai is top rated, and none of them ever talked to us, none of them. And so while I'm an incest survivor in my own home, no one's talking to my mother in Spanish, no one's talking to us, and I'm just out there. And I end up looking like what trauma looks like and what we're now seeing in terms of what Lisa's talking about when she talks to you about what it looks like when we have unleashed and our anger is police and we cannot release. And so we end up looking angry. So this person in front of you was a truant. I did drugs. I was trying to kill myself slowly because I could not deal with the anger that I had because I did not live in a safe home. And it's important to me to make this distinguish because on this call, we are all putting side by side and comparing COVID and police brutality and how it impacts communities of color. And now I'm going to take you to sexual violence against women and violence against a group of women, Black women, and police violence of Black lives. And I'm going to juxtapose them, and I'm going to try to stick to the public health issue. But the next word that I want to bring into this, so the first word is, I'm going to talk to you about a human right issue, that if it is a human right issue, then it is a public health issue. It is a social issue. It is a criminal justice issue, right? And so so let's not play games, okay? Gender-based violence, child sexual abuse, sexual violence, domestic violence is a human right issue. And it becomes a human right issue when you could talk about Black people. And why? Because it was the #1 thing that this country was founded on. And so during the transatlantic slave trade, what we call the Ma'afa, people were not just brought here, they were kidnapped, they were held, they were stuffed in slave ships. We got to talk about that. That's all trauma, people. And we didn't have trauma centers. We didn't go nowhere to have a grief center. We had trauma centers. And then we get brought here, and guess what? Our bodies as women become breeding grounds. That's violence. Do you understand me? And those same violences are similar in what we see in police violence. So I'm going to try to compare those things, and I'm going to bring you back to justice for Dahmeek in the little bit of time that I have. And I'm going to end, hopefully, with a statement that we're making as we prepare for Sunday's rally in my city. And we add our voices to the thousands of voices of the movement for Black lives across this country. Okay? And so, with that said, we got to talk about historical trauma. I will encourage Asi-Yahola and Linelle, you got to talk about historical trauma. You cannot talk about all these other traumas and not talk. You've got to include, we can no longer bite this lie. What is that historical trauma? Is the Ma'afa. And stop telling the lie that that only happened in the United States. That happened throughout every corner of this country. 90% of those slaves that were captured were brought to where? Brazil. Brazil. Brazil is where? In Latin America. Why do they speak Portuguese? Because the Portuguese were down with enslaving us. Do you understand? So the difference between the blacks in Latin America was that ours was the Spaniards, for African Americans were the English. Do you understand what I'm saying to you? This was the mastermind. And so we have to talk about global blackness, because the same thing we're seeing here with COVID, we're seeing in Brazil, we're seeing in Africa. Do you understand? It's global blackness. And I am not saying that we're not seeing these issues in indigenous communities, in Asian Pacific Islander communities, in Native Hawaiian communities, and in culturally ethnic Latino communities. But we're talking about Black lives, and I cannot water that down, because Black lives have been attacked ever since we was kidnapped and brought here, and that has never stopped. And this country has never atoned for what does that look like. And since it's never atoned or had a healing process or some kind of restorative process for how do we begin to reconcile and have a truth and reconciliation so that people can release what that pain is. And instead, we're here, and how Lisa said, our rage, and rage is important, because rage is police. We cannot rage. This happens to rape victims just as well. A rape victim cannot rage. Why can't she rage? Because the minute she rages, it's not self-defense. She killed him. When a domestic violence woman self-defends herself to shoot him after he beat her ass for 5, 10 years, 3 years, and that one day she snaps and he might have been sleeping and she shoots him, and the judge says, ma'am, that had to be intentional. Was he hitting you at that point? No, but he had hit me all this time. What was that? The historical trauma of her life, right? Do you get the connection? So these kids are out here. They have historical trauma of getting beat up every day, of being police. Pull your pants up, pull your pants down. They go to school. They're told your girls can't go to school with your hair. You know, you're distracting, go home because you're showing your stomach. There's a way that our lives are policed, and these kids are policed so heavy that they're angry. So whether they behave, right? Louis Gates behaved and he still got stopped. Or whether they shoot back, they die. And so what happens when you have historical trauma and it's over time, you think of yourself as disposable, just like I did. That's why I did drugs. That's why I did petty crime. That's why I did things to hurt myself. Do you understand? Okay? And so we can't talk about these things in isolation. Violence is a human rights issue. And I'm going to talk to you about intersectionality. That's another word you need to connect. And so I like that we can talk about public health, but if you're going to talk about public health and you're comparing stats, then you've got to connect that to intersectionality. And so Combahee River Collective and Kimberly Crenshaw has extended that. We got to bring those pieces in this. Asi-Yahola, you know that, right? Because as organizers, that's what we do. And so you've got to bring what they're saying about intersectionality in order to understand why in this country, if you're a Black trans person, right? You're a Black trans person, you are not only disposable because you're Black, but now you're disposable because you're trans, right? And so what does this have to do with child sexual abuse, just opposed to police violence? Because that Black trans person shares that history that I do of the Ma'afa, and they share that history of violence. And guess what? Do you know who takes advantage and rapes and kills Black trans people? Police. Tony McDade. So we know about Aubrey, right? Then we find out about George Floyd, and then we find out about Breonna, which was actually in March, but we're finding out today. And then Tony McBray was a Black trans woman who got shot by police in Tallahassee, all within what? 2 months. So are we paying attention? And then you add that to the reality of what has happened in this city for us in terms of, in 2015, we had a man who I would call was like I was as a child sexual abuse survivor, killing myself and doing all types of things and being out there. And so of course, then that means that, oh, she's stereotyped And so she's that because she's Black, she's poor, she's Latina, she's from the hood. So Faison was a blood. He was a blood from Albany, a gangbanger. You know what that means, right? And so he was a blood. He came to Troy. The police watched him. He tried to protect himself. Why? Because he's lived with trauma, and safety is not something that is that's not a freedom to us. It's something we have to fight for. He shot the police killed him. They killed him. We stand for him as well, because we also stand for the little girl that Luce was, and the other little girls like Tarana Burke, who's also a child abuse survivor, who also has had crazy trauma experiences. And we begin to understand. So don't talk to me about ACEs. Don't talk to me about ACEs, because ACEs is not applied to the Black community. Why? Because for whatever reason, our skin color stops these ACE people and these trauma-informed people from seeing us and our trauma. So talk to me when you all start reading Dr. Joy DeGruy's book, and you read about post-traumatic slave syndrome, and you begin to see that, of course, there's a connection between trauma that we experience in our brain and the physiological things that happen. Okay? When that flight that one of the doctors talked about, flight or freeze, and I'm trying to hurry up because I only got a few minutes, that is about cortisol. Cortisol, the body's amazing. It does exactly what it's supposed to do, right? At all times. And when it doesn't, it's because something's not right. And so flight or fright for a rape victim or for a police violence victim is, I gotta get the hell out of here, or I freeze, right? Flight or freeze, right? Right? And so your body releases the what? Cortisol, because cortisol is what gives you the strength to go. Well, guess what? Too many high levels of cortisol over time have an impact on your brain, have an impact on your heart, have an impact on your autoimmune system. And so I'm sitting here at 53 with hypertension and heart disease, and I ain't the only one. Do you understand what I'm telling you? Do you see the connection? And so when you read Dr. Joy Leary's work, she breaks that shit down. She breaks that down, high levels of cortisol over time. We could be happy, but we still got high levels of cortisol because that's what the body knows. But the body is an amazing, amazing thing. And the last two things I want to say, I'm going to say three things next, is stop with this culturally relevant stuff. There's public health language and public health law, and it is because if any other policies have talked about equity, it's public health and education. And that's why we have HBCUs in this country and Indian serving colleges, right? And that's why we have HELP programs, and that's why we have public health programs specifically that talk about looking at the connections of things like breast cancer, battered maternal health issues for Black women. Do you get it? And so use the term culturally specific programs. Culturally specific programs means that if you are a program that is by and for your community, you are a culturally specific program, regardless of whether that is a Black program, a Latino program, an Indigenous program, an Asian program. Do you get it? That is not the same thing as being in the Harlem and being the Harlem Rape Crisis Center. They just happen to be in a community of people of color, but they weren't developed before and by people of color or Black community. The Black Women's Project in New York City is a culturally specific program. They're founded by their board, their staff, and everything about them is they're a culturally specific program, their mission, their work. And so let go of this culturally relevant, because culturally relevant is too broad. And from an activist stance, it brings everybody in the fold. So the response that you're seeing across the country is a Black specific response to the rage that we've not been allowed to release about the historical trauma that we've had over centuries in this country, that this country has developed a capitalist system on the backs of my ancestors and those of you who are on this phone that claim your Blackness. So Wall Street was built on us. You understand me? This country founding capital, so there's a connection between capitalism, right, and this freedom. And so y'all are gonna see that Black people, as we've always been, the moral frame back and the moral compass of this country, as Martin Luther King said, in terms of how do we take the shit down with capitalism. So while it looks like it's police violence and that is what we're going for, right? Because now we're going into activism, It is really at that intersection of race, sexism, right? Racism, sexism, classism, right? Homophobia, like heterosexism, right? You get it, right? You get all the isms and anti-immigration in the midst of whoop, make America great again. Why? Because white women failed us. They failed us when they allowed a rapist to what? Get into that White House. They failed us. We think he's a joke. He's not a joke. He's here to kill. And so you got us. So if we as adults were not stopping that man, and we were not focused, and we were not protecting our kids, just like I wasn't protected as a kid, then these kids are gonna protect themselves. And that's what these kids are doing. And that's what you're seeing with all these rallies. And so Justice for Dahmeek is about centering Black children and Black lives. And Minnesota and Atlanta and daggone Kentucky and Chicago and in New York, and our children are raging. They showed us signs. They showed us what's called red flags. They showed us the red flags. They showed us that they couldn't sit still in school. They showed us that they were all over the place and ADHD and medicate them. They're showing us that they have low self-esteem, or they're showing us that they're over a misogynist. They're showing us this and we're not paying attention the same way I showed an over sexual risky behaviors and had abortions. Do you see the comparison? So if we know that women who protect themselves should have a right and be seen as self-defense, it should not be taken and filed for criminal justice, then we have to understand that this looting shit and what y'all are all talking about, these kids are protecting themselves because they know that they're either gonna go down behaving or they're gonna go down fighting. So we have got to stop thinking of them as looters. They're not looters. Our kids are trying to tell us something. Our Black people have been trying to tell this country something for years. We have a long story of civil rights movement. We had young lords for Puerto Rican independence. We had the Black Panther movement. We had berets. Come on, we've been trying to say something for a long time. We've been peaceful with Martin Luther King, and Martin Luther King talked about rage was gonna happen. He talked about that. And even though those were peaceful marches and the sit-ins, people still got beat up. So we as adults have failed our children, and we, like many of our comrades across this country who are some of the baddest ass amazing people. And in Oakland, you got Mia Mingus, you got Sujata Baliga, you got in Wisconsin, Maria Adams, and many of us know each other, and many of us are connected to the gender-based violence movement because we are survivor leaders that are prison abolitionists. And we rather sit with formerly incarcerated people to begin to look at community alternatives as it pertains to how do we end violence in our communities, because we want to end violence. And the police is not a solution. It's a false reality for you to think that a police at a march and for me to engage with police is gonna make any march and any protest safe. That is a false reality. Who's it gonna make it safe for? You're talking about white people, right? And so on Sunday, June 7th at 2 o'clock, if those of you, I don't know if y'all are from upstate or where you're from, are more than welcome to join us. The work that we're doing is a collaboration. This is the first time this ever been done. It is called, let me back up. The foundation it's an All For Us coalition. They came to us for Jamaica Miles, who is a kick-ass activist and advocate who does a lot of policy work on behalf of our state around criminal justice reform. She called us. She said, I want to work with you. Maud Arbery had just died, and we wanted to do the 2.23 miles, and we want to do a March rally in Schenectady. Can you come? And we want to do one in Albany, and we want to do one in Troy. And so that's what this was all about. It was, how can we, 3 cities who are focused on police brutality, come together to pay homage and solidarity to his death, while at the same time paying homage and solidarity to the Black men that have been killed in our cities, and come together, because that's not ever been done in my area. So New York City, they come together, but we don't do that here. And so this is what that is. In the midst of us planning that, George Floyd got shot. And then Tony McBride, the trans woman, and the trans man in Tallahassee got shot. And then we find out about Breonna. And if you don't think we were full of rage, absolutely we were. Because on top of that, we are still raging over the fact that in 2016, 2015, they shot Faison, who they say shot at him because he was armed. In 2016, they killed and shot Edson Thevenin, who was a 30-something. He's an older man. He was going home. It should have been just an easy traffic ticket. Instead, they blocked him and they shot him. He had no weapons, no nothing. Should have been just a traffic ticket. And then, of course, Dahmeek, who's given us the honor of carrying his name, who played football with my son. And he did not die. He was injured. But even though he was injured, it should have been just a typical parole violation. And he's been sitting in jail since 2017. And so we honor them, and we honor the ones that we don't know, and we honor the ancestors, and we honor Floyd and Maud Arbery and the ones, and we figured out how to come together as a country and honor those nationally while we focus on our folks. Albany's got Alizon, Nakeem, and Schenectady's got a handful of them, Anderson Kears. And the thing about this is the district attorneys are involved in the whole conspiracy of it all, and so are the mayors. So if a case is held here and we raise all hell out like we did with Justice for Dahmeek, they move it to Schenectady, and it's like just leaving it here anyway. So this for us is just not police brutality, it's the entire criminal justice system. And so I had a statement, they took it down. Hopefully you could read it. Basically, it is a statement. The police want to meet with us because they want to ensure safety. We don't feel that that is a safe thing for us. And so thank you. I'm so sorry. I'm going to read it fast. Maybe you could click it and put it into the link and people could keep it. This Justice for Dahmeek, a Troy grassroots organization, and I'm so sorry because I know it's late, challenging the violence, brutality, and lethal force of Troy police and local officials against the Black community. We formed to demand accountability for the police shootings of Dahmeek McDonald in August of 2017, and we continue to expose and denounce the police murder and official cover-up in the murder of Edson Thevenin in 2016. We're calling for a peaceful rally for Black lives this Sunday, and I told you the date and you see it, and we're starting at 2 because we fear that they are gonna institute a curfew because they're nervous. They've already started boarding up everything. You go downtown and all of a sudden everything's Black lives, but we've been organizing for the last 3 years. We meet at the Sanctuary for Independent Media, who is your host, and they've never wanted to meet with us. They give us a hard time all the time. We did the peaceful process, and here's where we are. And now you're calling us to meet with us, so we did the statement. This is intended to be a peaceful protest. We acknowledge the words peaceful and nonviolent are often used to divide and villainize passionate Black, Indigenous, and people of color. The violence we condemn is the violence that comes from the top in our country, our state, and our city. The violence of police and vigilante murder and brutality against our communities. The violence of official doublespeak and cover-up. The violence of an economy where the rich loot millions from the poor every day. The violence of endless wars to bring the same white supremacist system by force to the rest of the world. The violence of inaction and silence. We don't want to hear from these purveyors, caramba no sé, of violence that our youth are violence. We don't want to hear from looters of billions that our people are looters. We don't want to hear from those who silence the screams of we can't breathe, that we are making too much commotion. If you had listened to these voices, if you had listened to these voices, if you had listened to these voices a year ago, 10 years ago, 100 years ago, we wouldn't be here today. We support the righteous rage of our community. Ashe.
Whew.
Breathe, people, breathe.
I'm gonna take your recommendation to breathe. Well, thank you so much for that. That was amazing. We have about 15 minutes left. And yeah, we were hoping to have time. I know everyone has a lot of thoughts, a lot of feelings, and this was definitely, had a million of those emotions and thoughts. So yeah, we want to leave it open for questions at this time or a discussion. There are a couple questions that were brought up, but does anyone have any questions that are kind of burning right now? You should be able to unmute yourself if you want. Well, maybe to start, we'll do some that have already been sent in. And like I said, you could put questions in the chat too, if if that works better for you. One question, and anyone can take it, of the panelists. In terms of solutions, agree that the profit healthcare system is a detriment, but no one is really able to say how to return it to a not-for-profit situation. So must we plan to live with the consequences from thus forth? The powers that be will not let go of that money which it has become accustomed to. I'll kind of leave it open to anyone that feels like they have a good answer.
I'll take a swing at it. So we have our profit. Our American health care system isn't even really a system. It just kind of it was a accidental system that just came together from the different interest groups and stakeholders trying to just extract the most profits that they could out of our healthcare system and turn it into a business rather than something run for the public good. There's a possible framework that Bernie Sanders and other politicians have put forth to try to make it more equitable and fair, but there's just so much pushback from all these corporate interests that stand to lose so much if our healthcare system is made public. But I feel like with the pandemic, the tide's turning with that, especially because people are this pandemic is highlighting how just inane it is to have healthcare be A, tied to employment, and B, be based on whether or not you can afford it, because it's just undermining our public health efforts to contain this epidemic at every turn. So I think COVID is a major turning point for the healthcare in our country, and that in the aftermath of this, I think we really might see universal healthcare because it's been vindicated. Like anyone arguing against it doesn't have a leg to stand on anymore.
And often from a community's grassroots, we often talk about the revolution will not be, what is it? The industrial nonprofit, whatever system. And so we've seen that in the Rape Crisis Center movement. So the violence weren't about with criminal justice, but they do work with criminal justice because of the Violence Against Women Act. And they've had to sell out half of their original history. And so we are here today looking at elections coming up of there's no possibly. We got to vote for 2 sex offenders. And I worked with Biden's office, you all, because he was vice president of Obama, and their presidency instituted a violence against women liaison, and that's how we get in there, And so here we go, right? My daughter and I talk about this shit painful as hell. We know we got to vote for that daggone man who I know, but it's hard. And then Me Too, Sharana Burke puts out this whole statement, and she's like, Biden could be held accountable and president too. Well, bullshit. In the same way that Trump shouldn't have been president and should be held accountable. So absolutely nonprofits. There's a thing that if we're not intentional and we're not reading and then we're not swifting these issues as a human rights issue, we lose what our intent is, and we think, oh, that's just a public health issue. That's a criminal justice issue. Nah, Black feminism did this for us. The Kambari River Collective, Barbara Smith, Audre Lorde, June Jordan, Ceci Alfonso, they gave us a blueprint. And that's why people say Black women got magic and trust Black women.
I just want to just also too, just in terms of investment, that part of whatever policy decisions are made, they have to include investment or a reinvestment to address some of the social determinants of health. When we talk about access to healthcare, it's not just about opening a clinic so that people can go. It's also about the experience that people have while they are there, and all of the barriers that could interfere with them getting there and then being able to use or do what is in the best interest of their health and well-being. And I think that with COVID-19, the weight of preventing the disease, or, you know, so to speak, you know, the burden has really been placed on individuals without very little discussion about the institutional responsibilities and the institutional changes that need to take place so that we can, you know, stop the spread of the virus, but also, you know, simultaneously do things that will improve the health of all people, because it's not just COVID. So what about all the people who don't have COVID, but have all these other things going on, right? They're not getting any better care. Their care hasn't changed. Their care hasn't changed. It wasn't that great before, and it's not that great now. But, you know, so I just think that so much of the burden around this, and even in the healthcare experience, the burden is put on, you know, the individual without consideration for, you know, what the institutional and governmental responsibilities are. And I think that for people of color, for Black and brown people, you know, for us, particularly as a Black woman, that blame, like we get blamed for everything. You know, you get blamed for everything. Well, if your baby dies prematurely, you get blamed for that. If you got diabetes, you get blamed for that. If, you know, and no one talks about, you know, the deliberate policies that create these neighborhoods and then sustain the, you know, they keep the neighborhoods down and oppressed, you know. So I just think it's too much at the individual level, and not enough institutional accountability. And that's especially true when we're talking about the disparities in COVID-19. And that's been the national conversation. It's very discouraging.
Great. Any other questions? JJ, you have a question?
Yeah, thank you all so much for being here and all your time and energy. Yeah, my question is about like for the current moment, and too, like in the winter too, and as like people say, like if the COVID then starts to surge again in the winter, I felt like you know, with all these questions, like especially in New York City around hospital beds and who's going to get the ventilators, like people are like, well, we're going to just have to, you know, if somebody has all these high risks of obesity and diabetes and all these things, like, you know, they're the bottom of the line because we need to only give them to the people who are going to like have the best chance of surviving. And just this, like, the lack of, or the conversation around that about like that it's not natural about who has the highest risk for obesity and all these problems, and then how it feel like it seemed like in conversations with Frank or other people in hospitals that administrations were like, well, we just need to give it to the healthiest people, and how, for lack of just screwed up that is. And it didn't seem like there was a lot of pushback. It was like, oh, okay, well, yeah, we got to save who's going to get saved, which is totally, messed up. So I'm curious about like conversations going on in healthcare and people who are working in hospital systems to push back against those narratives, that perpetuate these like, inequalities in healthcare. If that all makes sense.
I think that comes back to what I started off talking about with language and how we frame these things, how we discuss them. By having that discussion in the hospital, but not asking, well, okay, why do they have higher rates of diabetes? Why do they have higher rates of heart disease? Why are these groups of people particularly vulnerable? When we limit our language and have our cognitive dissonance determine what words we use to describe these problems, because we don't want to grapple with the reality of, you know, the injustices that we live under, and we say things like, oh, it's a disparity, as opposed to, no, it's an injustice, or something like that. When we use that limited language, we limit our imagination, we limit our action, and we limit how our audience perceives that. And so we have to, anytime we hear these discussions, always just ask why. Well, why is it this way? Why is it that way? Don't just accept it as the natural order of things. That's all I got for that.
And also the notion that people are expendable, right? So this speaks to value, who we value in this culture. And there's this one book, I had wrote this quote down. I just wanted to, oh God, where I put it? Okay. Oh, one of the phrases in this book called the death, I think it's the name of the book is called The Death Gap. And one of the things that the author talks about is that disease and death wear similar masks around the world, right? And that goes to Luz's point about Black, right? That's the mask. So when it comes to disease and death, that's the mask. And so, as long as there is this devaluing of people in Black skin, that's always going to be a challenge. So there are certain, I'll give you an example, like, so, with strokes, right? We know that there's I'm not a doctor, right? But I make it my business to know certain things, because we just have to know certain things. When you have a family, you got to know certain things, right? And there's a protocol. It's a typical protocol, or whatever the case may be, that, that's why if you have the early warning signs of a stroke, you hurry up and you get to the hospital, whatever, and they can administer TPR and, hopefully mitigate the harm that blockage is causing. And, one of the things is that, like, in some cases, like for me, when I have someone, or I know people that are going to the ER and they have certain symptoms or certain things are happening, you have to get there and try to be heard, because you don't have any assurance that a standard protocol is going to necessarily be offered to your person because of the color of their skin. And I mean, I'm telling you, that's not the conversation that medical professionals, they don't want to hear that. They don't want to hear that. So when I sit in meetings and other places and I hear blah, 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 and we do this and we do that and we do that, when I step up into spaces, I don't wear no titles. I don't wear none of that. I just say, hey, I'm Lisa. And I just go with the flow to see how people really get treated. And I have seen some things. So when you talk about Black men and boys of color, okay, when you talk about them as shooting victims and homicide victims, or whatever the case may be, they are viewed as expendable, and they are treated as such. Something as very basic as a comprehensive discharge plan with even a phone number on it for follow-up care. You have to screenshot and text the Department of Health guidelines around hospital discharge planning to even get a measure of professional response. It's unbelievable. So there is this there are people who are expendable, and through implicit bias, even when you have great doctors, I had a great primary care physician, but even through implicit bias, she was missing certain things when it came to my husband's health care or whatever. And I had to gather her together and let her know. She said, what do you do for a living? I do him. That's what I do for a living. Okay. And I'm going to need you to get on the page with me as it relates to these things that I'm asking for and requesting. And so, even in the context of that kind of advocacy, you can be viewed as hostile. I've seen people be put out the hospital for asking for legitimate care, something as simple as pain management. Put some gloves on when you touch my wound. I'm telling you, it's unbelievable, and it's heartbreaking. It's heartbreaking.
And I think that's what's exciting about this initiative that Brenda, the Sanctuary, has been working on with you all as a team. And I'm honored to be part of that in terms of thinking about community health. Community health came out of what? Black Panther movement and the Young Lords. I mean, in the Bronx, they took over a building together, and they brought people like Linelle, if she would have been at that time, and residents, and they applied health. They taught us, they taught my people how to breastfeed, how to do OBG exams, that's important. because the more we touch and we know ourselves, right, the more we take care of ourselves. And so this isn't about urgent care. This isn't about whatever. This is about community care, community health care. And I'm excited that the sanctuary, who we have a long-standing commitment to, is thinking about that, because I think that's the way to go. Because that's also the way to go around community accountability. We really want to talk about ending police violence, right? So just, you know, so those things all link together.
Wow, thank you so much. Well, it's 8:02, so we're a little bit over time, but I feel like we could probably keep talking forever, really, about these historical issues as we move forward. You know, there's somebody asked a question about a couple organizations that people would like to share. I think we've already shared some of the organizations that people have already done, but maybe just moving forward really quick, if the panelists could just list maybe one or two organizations that they feel are really addressing the issues that have been brought up today.
I'm going to say urban grief. I mean, we're not, you know, so I've had to make myself a content expert. And, you know, fortunately through an OVS grant in partnership with Trinity Alliance of the Capital Region, we actually have staff now. I have a trauma therapist, I have counseling psych interns, I have an advocate, I have an organizer who is also our peer outreach advocate. And so, you know, we're trying to, you know, build out this capacity to really serve. And even though the focus is victim services, you can see how broad, you know, my lens is in terms of the work that needs to be done. And a big part of that is, you know, being able to have people to have health, not just physical health, but mental health, and have collective spaces that facilitate our well-being.
Hi, I wanted to jump in. I didn't realize we had opened it up to questions. So just before we go, do I have a moment, Frank?
Sure.
Thank you so much. So we were talking about health disparities in our community. We piggybacked on that with justice and equality in our community. What sometimes we don't often think about is the intersection of both, and that is unemployment, underemployment, poverty disparities within our community. And so we often think of if a person is not on the welfare system per se, then therefore they have gainful employment, they should be able to make it, you know, they should be able to plan for a pandemic. We have allowed employers across the country to really push the gig employment narrative, that is the way of the economy and the way to the pathway to success. And the pandemic has proven that is a false narrative, because the employee then doesn't get the total compensation package. They might get an extra $2, you know. McDonald's might pay an extra $2 to get to that state minimum wage, which pulls you off the welfare toll, but they don't give you enough so that you can have sustainable employment. So we don't connect those pieces. And what often happens then is you don't only have people in the streets that have systemic you know, racial injustices and social injustice and criminal injustices. You have poverty injustices within our community. And because we don't speak and address that space enough fully, you see the rage that's out there. I'd like to see the numbers with those that applied for unemployment. You know, how many people were turned away because they were 1099 employees, and so therefore they were ineligible for unemployment. So I work in the diversity and inclusion space on behalf of the state. I have about 20 years of HR experience, and it's a passion of mine to create career pathways, opportunities to success. And so my question is, I say all of that because we need to have that paradigm shift. We need to start thinking about how we can create sustainable pathways to success for Black and brown faces. And so my question to the panel is, we often identify barriers to success. We don't often talk about what the progressive steps forward are in order to pull us out of those spaces. And so my question is, from a legislative perspective, from a healthcare system, and I know Asi had said that there isn't technically a system, but there is, you know. So from a healthcare perspective, as well as a community-based perspective, what are the tangible steps that we need to start investing in to pull our community out of it? Because we often place that one finger on the human, but there's four pointing back at us, right? That's a mouthful. My apologies. I'm put back on mute. Thanks so much.
Thank you.
Well, my 2 cents on that is that so often when we talk about jobs and economic development to address under the working poor, the needs of the working poor, right, where people are working very hard, but they're not working, they're not able to really live. And that represents a lot of people in our communities. One of the things, you know, we always talk about jobs. So when we talk about street violence or community violence, that kind of thing, we always talk about jobs and job training and job initiatives or whatever. But, you know, in my opinion, unless you do that, you have to do that through a trauma-informed lens, because to Loz's point about you can bring people into a work environment and they are triggered and they end up getting fired, they lose their jobs. And so when we talk about job development or sustainable or pathways to employment, you know, we have to have parallel support and built into those programs and into that space, you know, ways that we are coaching and supporting people through their trauma, right? Through their trauma. And we see the same in the academic world in terms of students, right? Where a student has to make a choice between passing an exam or, you know, going to their mom's funeral or something like that. It's ludicrous what we do to people. But that's, for me, that's one of the missing pieces, is that you bring a lot, you know, when people have a lot of trauma and they go into a work environment, it can be very, very challenging, especially when they're trying to create a career path, and that's not always accounted for. And even when people are aware of it, there's nothing in place to actually do something to help that. But it's definitely lots they can do to penalize it, but there's nothing to do to help that, so that we are creating career paths.
So I'm gonna answer this real quick because I know it's late and I took a lot of time. I put up in the link, because I like the question somebody asked about 2 organizations, the Movement for Black Lives, and Brandon and somebody look for it because I couldn't find it. Please Google it. It is literally exactly what Vanessa said. I'm so sorry, about wanting what the policy and the community and the organizing. So it does all of that. It is mainly authored by Andrea Rich in Barnard College, but they literally held meetings, and I had the privy of being part of the Violence Against Women one, the sister song in Atlanta with people like Loretta Ross and Aisha Shahida Simmons and a bunch of people. And so we gave input into that. And so what happened with Black Lives Matter is everything you all saw on TV, but what you all didn't see was that we were also organizing, and we were beginning to talk to each other, and we were beginning to identify and connect with each other. And so we all kind of know each other across the country in terms of, all right, you want to talk about criminal justice? Who are our leaders? Mia Menges, Mariam Kaba, right? These are the people that we go to when we talk about criminal justice and thinking about alternatives. You want to talk about health? Who do we go to? And those are who those are. And I can't think of on the top of my head because it's late. Once my violence against women, you got Luce, you got Amita Swadin, you got, well, she's not Black, but you know, you've got folks who are in there. And many of us are community activists, some of us are writers, some of us are reachers, some of us are attorneys. And so it literally is laid out. It's laid out. It talks about mental health, it talks about education, it talks about housing, it talks about employment, it talks about economy, it talks about race, it talks about it all, it talks about immigration. So it's all in there in terms of systems, and then how to organize around the systems so that people like me in Troy, New York can look at it and say, okay, these are our demands. And oh shit, it's the same shit they're saying, but they're also adding shit. You get it? And so absolutely. And then the last thing I want to say is, if this isn't about race and the intersection of classism and every daggone other intersection, then y'all ain't listening and y'all not paying attention. Because they're not just talking about police systems, they're also then going to Wall Street and Fifth Avenue. So y'all gotta pay attention. Y'all gotta pay attention. Don't get caught up in the narrative. They looting. We got the biggest looter, who's what? Mr. Trump. Nah, they attacking. They breaking shit down.
I want to take a crack at Vanessa's question really, really quick. Getting organized, I think, is what we can do to pull ourselves out of this. Getting organized and communicating with each other. You best believe our enemies are organized. So we need to look at voting as the beginning of our political action and engagement, not the end of it. We can't be expecting things to change when all we do is just every 4 years cast our vote for the musical chairs game of white supremacists and rapists that we've been doing. So we need to be active on a community level and educate ourselves and just be fully engaged in our lives and the worlds around us, and not leave it up to anyone else to try to make a difference.
Thank you all so much. This has been incredible and a lot to process. And yeah, like Lou said, you know, lots to read up on, lot to stay aware of. You know, just a couple things, you know, as we close, just in the chat box, I put up there's a link to sign up for our email list, just like a Google sign up, you know, just for the Health Autonomy Clinic. We'll be having some events to be determined over the summer. We're going to maybe try to transition to some social distance outdoor events. You know, also the sanctuary has been around for more than 15 years, that essentially volunteer and grant run. So if you have the means to, especially in these tough times, please donate to the sanctuary. There's a link in there about how to give. You can be a monthly supporter for any kind of amount. And there's a bunch of events coming up. Obviously the Troy Rally for Black Lives that Luce mentioned, that I know a lot of us will be at. And then the sanctuary is hosting a few talks coming up, the Shut It Down book talk, the Norlight Town Hall, and a movie showing of The Eagle and the Condor, kind of all online. So if you go to the link there about events, you'll see it. And you know, one thing really quick, just in the immediate space around you, if you could just find something that means something to you. All right, so take 20 seconds and go find it. It can be anything. But yeah, just hold it up in front of your screen. And if somebody could take a picture, that would be great. Cool. Just to share a little bit of ourselves, huh?
Hey, brother.
Well, thank you all so much. This is really beautiful. This is the beginning of a much larger conversation. And, you know, check us out on the Facebook page, on the Media Sanctuary page, and sign up for emails, and we'll send you next events about the Health Autonomy Clinic.
Yeah, and as you're leaving, bring your kids. We're going to have a children's zone. We got volunteers. Everybody in Troy, Oakwood is helping with volunteers, the Y. So bring your kids. It's not a drop-in for daycare center. You got to watch your kid because child sexual abuse is real, but they can play. They're going to color Black Lives Matter, the white kids too. And then we got music. We're going to have drummers. We're going to have libation. We're going to have speakers from Albany and Schenectady because it's a coalition. No, we're not going to have no politicians talking, no nothing. Essence Evan's mom is going to be there. Dahmeek is going to be there. Some family from folks from Albany who've been harmed, and so forth. My entire team, Justice for Dahmeek is going to be there. Naomi Jaffe, Anastasia Robinson, Messiah Cooper, Amani Ologaba, Alfonso Rodriguez, Olivia, who's a poet, Will Donovan, and please come spend the day with us, enjoy us. Our businesses, many of them are going to have free food and free walk as you walk or march, and so it'll be right in front of their businesses. So they might have, you know, boulders, but they're going to provide that. And so please do. We have one Black business who asked Luz, because of COVID, I don't have a lot of money. Do you mind? I said, make patties and ask people to pay you what they can. So please, first choice, you know, and so come to our Troy. It's a beautiful city. We love our city. We love our city. And that's why we're fighting for. We love our city and we love our kids, and we're tired. And so thank you.